Okay, so we're diving into public health policy officer interview prep. We've got a whole bunch of RoleCatcher resources to dig through, career guides, interview guides, even some stuff about their AI. Let's use all this to help you really stand out in your interview.
Yeah, it's a cool field, you know? Combining science with policy to make communities healthier. Let's jump into how to show them you're ready for this kind of role.
RoleCatcher really stresses that you need to show you get the job. Like one of their sample questions is, what made you want to become a public health policy officer?
Yeah.
What's the best way to go about answering that?
It's about showing your passion, you know? Like what really drives you. They want to see how your story connects to the job. Maybe you saw some kind of health disparity that got to you, or you're inspired by some big name in public health, or maybe you just love that mix of healthcare and policy.
So don't give some canned answer. You got to make it personal. RoleCatcher even mentions using their AI to look over your answer.
Oh yeah, for sure. Their AI can give you feedback like on how you're speaking and stuff, and it can make your answer even better like a virtual coach.
Cool. Okay, so another common one is, what do you think are the biggest challenges facing public health policy today? Feels kind of broad, right?
It is, but that's the point. You can show them, you get how complex public health is. Like, are you up on the debate about healthcare access or how different funding models affect community health programs?
So don't just list problems, connect them to the bigger policy picture.
Exactly. And RoleCatcher's AI can actually look at the job description and suggest ways to tailor your answer to what they're looking for. Say the job's focused on rural health. You could talk about the struggles of providing care in those areas.
That's pretty slick. All right, another question. What strategies do you use to stay up to date with the latest developments in public health policy? Seems like they wouldn't ask if it wasn't important.
Definitely public health is constantly changing. They want to see you're committed to keeping up with it all. Do you read the journals, go to conferences, belong to any professional groups?
I'm guessing it's not enough to just say you do those things.
All right, give specific examples. Did some article in The Lancet change how you think about vaccines? Did a presentation at a conference give you ideas for community outreach?
So show them you're not just passively reading stuff, you're applying it. I bet they'd love to hear about a time you changed your approach based on new research or policies. Okay, what about this one? How do you balance competing priorities when developing public health policies? Sounds like a real-life scenario they're throwing at you.
It is, and it's your chance to show off your critical thinking. Public health is all about juggling limited resources, different needs, sometimes even conflicting evidence. They want to know how you handle that kind of pressure.
So you could talk about using something like a cost-benefit analysis to weigh options, or how you get stakeholders involved to make sure everyone's voice is heard.
Exactly, and think about your own experiences. Have you ever had to choose between two equally important initiatives? Share how you approached it, what factors you considered, why you made the choice you did.
Perfect way to show you can think on your feet and make tough decisions. Plus, it shows you've actually been there, not just read about it in a book.
And remember, RoleCatcher's AI can help you polish your answers. Their interview practice tool lets you record yourself and get AI feedback, like having a coach analyze your delivery and tell you how to make your points stronger.
That's super helpful, especially for getting comfortable talking about this stuff. All right, let's tackle this one. How do you evaluate the effectiveness of public health policies? This one seems pretty straightforward.
You'd think so, but it's your chance to show you get data-driven decision-making. It's not enough to just put policies out there. You got to know if they're working.
So could you talk about using program evaluations to collect data on the outcomes? Or the importance of performance indicators and metrics for tracking progress?
Exactly, and think of a specific example. Did you ever evaluate a policy and find it wasn't as effective as you hoped? What did you do to analyze the data, find areas for improvement, maybe even revise the policy?
That shows you're not afraid to admit when things aren't working and that you're always trying to improve. Plus, it highlights your analytical skills and your ability to adapt. I'm noticing a pattern here. These questions are all about showing you can actually do the work, not just talk about it.
You got it. They want to see how you apply your knowledge in the real world. And that brings us to, can you describe a time when you had to navigate a complex political environment to achieve a public health policy goal? This one can seem a bit intimidating.
It does, but it's super relevant. Public health policy often bumps up against politics. They want to see if you can handle that.
Think about a time you faced pushback or had to work with people who had different views. How did you handle it? Did you use data to back up your arguments? Did you team up with other organizations? Were you able to find common ground and build consensus?
This is where you can really show off your communication and diplomacy skills. They want to see you can fight for your ideas, even when it's tough.
And don't forget, RoleCatcher's AI can analyze the job description and suggest ways to tailor your answer to the specific skills they're looking for. If the job involves lots of community outreach, you could talk about a time you got different groups to support a policy.
Smart. Okay, last question in this set. How do you ensure that public health policies are equitable and address the needs of diverse populations? Feels like a core value in public health.
It absolutely is. Health equity means everyone has a fair shot at being healthy, no matter their background or circumstances. They want to see that you're committed to addressing disparities and making healthcare accessible for everyone.
So how can you show that commitment in your answer?
Think about your strategies. Do you do health equity assessments to figure out the needs of different groups? Do you actively involve diverse stakeholders in making policies? And how do you use data to track progress towards health equity goals?
All great points, and again, a specific example would be helpful. Maybe talk about a policy you worked on that aimed to address disparities, and the steps you took to make sure it was implemented fairly and got good results. It's one thing to talk about health equity, it's another to show how you've actually put it into practice.
For sure, and remember, RoleCatcher's AI can help you tailor your answer to highlight the specific skills and values the employer cares about. If they emphasize cultural competency, you could talk about your experience working with diverse communities and adapting your approach to their needs.
Such a valuable tool, making sure your answer matches what they're looking for. We've covered a lot in this first part, breaking down these 7 key interview questions from RoleCatcher. I gotta say, I'm already feeling more prepared for my own imaginary public health policy interview.
Glad to hear it. We focused on these questions because RoleCatcher's resources suggest nailing the interview is often the key to getting the job. But it's also really important to understand the bigger picture of this career.
Let's shift gears to that now. What insights does RoleCatcher offer about the career path of a public health policy officer? Like, what are the different stages, and how can someone in this role expect to grow?
Their career guide actually breaks down the typical path, outlining different stages from entry level all the way up to senior positions. It's like a roadmap showing you what you can expect as you gain experience.
Sounds incredibly helpful, especially for someone just starting to explore this field. What does an entry-level position usually involve?
At that level, you'd probably be assisting more senior policy officers, things like doing research analyzing existing policies, helping to spot problems and recommend solutions. You might also support stakeholder meetings and prepare reports. It's a great way to get your feet wet and learn from the pros.
Makes sense. You're building skills and getting a feel for the day-to-day work. What happens as you move up to the next stage?
As you go into a junior role, you take on more responsibility. You'll be more involved in developing and implementing policies, doing more in-depth research and working with stakeholders to get feedback. You're going from assisting to actively shaping policy.
So it's about going from learning to contributing your own ideas. What about the next level, the intermediate stage?
At that level, you step into a leadership role. You're not just contributing, you're leading the development and implementation of policies. You're doing comprehensive research and analysis and working with key stakeholders to get support. It's a more strategic role focused on making a real impact.
Wow, so you're not just influencing policy, you're leading the charge. What's it like at the very top, the senior level?
As a senior public health policy officer, you become a leading voice in the field. You're responsible for making and implementing strategies, doing research on complex issues, and advocating for changes at national or even international levels. Your work can have a huge impact on public health.
That's incredibly inspiring. Sounds like a career with tons of potential for growth and impact. But it also sounds like it takes a lot of dedication and continuous learning to stay on top of things.
Absolutely, but the good news is RoleCatcher provides resources to help you along the way. They highlight the importance of certifications like Certified in Public Health, CPH, or Health Education Specialist, CHES, to show your expertise and commitment to the field.
Those certifications could be a great way to show employers what you've got and stand out from other candidates. And as you move up in your career, I imagine there are other ways to showcase your expertise beyond just certifications. What does RoleCatcher suggest?
They highlight a few things. Publishing research in peer-reviewed journals is a great way to get recognition and contribute to the field. It shows you're taking initiative and are passionate about advancing public health. Presenting at conferences or policy forums is another good option. It lets you share your knowledge, connect with others, and stay current.
And of course, in today's digital world, having a website or blog can be a powerful tool. To showcase your work, share your thoughts, and get involved in policy discussions. Social media like LinkedIn is also great for connecting with other professionals, sharing your perspective, and staying informed. It's all about building your professional presence and becoming a thought leader.
Exactly. And don't underestimate networking. RoleCatcher really emphasizes connecting with people in public health policy. Through industry events, professional associations, and policy forums, those connections can provide insights, mentorship, and even job leads.
Networking can be intimidating, but it sounds like it's crucial for a successful career.
It is, but remember, it's not about collecting business cards. It's about building real relationships. Focus on learning from others, sharing your experiences, and finding ways to support each other.
That's great advice. So we've talked about acing the interview, explored the career path, and even touched on networking and continuous learning. I'm feeling much more informed and prepared.
Fantastic. And before we move on, let's not forget about technology. RoleCatcher's AI tools can be incredibly helpful for your application materials, practicing for your interview, and even gaining insights into specific jobs. It's like having a personal assistant coach and research team all in one way.
I'm excited to dive deeper into how these AI tools can help us succeed in this field. But first, let's take a short break. We'll be right back with more insights from RoleCatcher and a deeper dive into public health policy. Welcome back. Before the break, we were talking about how RoleCatcher's AI can be a game changer for this whole career path. I'm really curious about how it can help tailor your resume and cover letter.
Oh, it's super powerful. Like, imagine you're applying for a specific public health policy job, right? And RoleCatcher's AI goes in and analyzes the description. It figures out the keywords and skills they're really looking for. Then it gives you suggestions on how to tweak your resume and cover letter, so you're highlighting the most relevant stuff.
That's like having a resume expert who knows exactly what each job needs. No more guessing about what to emphasize.
Exactly. It makes your application stand out and ups your chances of getting noticed. And it doesn't stop there. RoleCatcher's AI can even help you during the interview.
You mentioned their interview practice tool earlier. Tell me more about how that works.
It's like having a virtual interview coach. You record your answers to those common questions, and the AI analyzes how you're speaking, your tone, the content, everything. Then it gives you personalized feedback, like how to be clearer, sound more confident, make a bigger impact.
So it's not just about knowing the answers, it's about how you present yourself.
That's it. The AI can even help you tailor your answers to the specific job. Say the role is big on data analysis. The AI might suggest you give more examples of how you've used data to make policy decisions.
This feedback seems so valuable, especially for someone who gets nervous in interviews. It takes the pressure off knowing you have this tool to help you prepare.
That's exactly it. It's about giving you the tools and resources to feel confident throughout the whole job search. It's about using AI to maximize your chances of success.
I love that idea of technology empowering job seekers. It's not about replacing human skills, it's about making them better and making the process smoother.
Exactly. It gives you an edge. And the best part is RoleCatcher's AI is always learning, taking in new data and getting better to give you even more accurate and helpful feedback.
It's like having a partner in your job. Search someone who's always there to guide you. Speaking of partners, let's talk networking and public health policy. RoleCatcher really pushes this.
It's so important, especially in a field like public health, where everyone's working together. Building those relationships can open doors, give you insights, offer support and mentorship.
I can see how valuable those connections would be, especially when you're starting out or facing tough policy challenges. But where do you even begin? Networking can be intimidating, especially for introverts.
I get it, but remember, networking is just about connecting with people who share your interests. It doesn't have to be scary. Start by going to industry events, conferences, workshops.
Those are great places to meet people in a more relaxed setting. Less pressure than a formal interview.
Right. You can listen to presentations, join discussions, connect with people working on things you care about. Professional organizations are another great way to network.
Like the American Public Health Association.
Exactly. Joining those groups gives you access to a whole network of like-minded people, plus opportunities for professional development, mentorship, and even job postings. And don't forget about online networking.
Like LinkedIn.
It's a powerful tool. Connect with people in public health policy, join groups, participate in discussions, share your thoughts. It's a low-pressure way to build your network and stay up to date.
Those online connections can turn into real-life relationships. I know people who've gotten jobs through LinkedIn.
Absolutely. And networking isn't just about jobs. It's about learning from others, sharing experiences, building a support system.
It's about creating a community of professionals working towards the same goal, better public health.
Exactly. And with RoleCatcher's resources and AI tools, you're well equipped to handle the job search. Build your network and start a fulfilling career in public health policy.
It's inspiring to see how technology and human connection can work together to empower people and make a difference.
And as we dig into the specific challenges and opportunities in public health policy, remember your passion, your dedication, your commitment to making a difference are your biggest strengths.
Those qualities are at the heart of this profession. Let's keep exploring this fascinating field and dive into some of the key issues that public health policy officers are tackling today.
We'll look at how those issues are shaping the future of healthcare and explore the innovative solutions being developed to address them.
Stay with us as we continue our deep dive into the world of public health policy. We've talked about nailing the interview and building your network. But what about the actual work? What are some of the big issues public health policy officers are dealing with right now?
That's where it gets really interesting. RoleCatcher's Career Guide touches on some of these challenges, but let's break them down further, like the rising cost of healthcare. It's a huge problem that affects so many people. Public health policy officers are right there on the front lines trying to figure out how to keep costs down without sacrificing quality care.
Yeah, that's a tough balancing act for sure.
Yeah.
What are some other hot topics?
Well, you can't ignore technology and how it's changing healthcare. Telehealth, for example, has just exploded, offering amazing potential to reach more people, especially in rural areas. But it also brings up a whole new set of policy questions about regulations, privacy, making sure everyone has access to the technology.
So it's not just about traditional healthcare systems anymore. It's about keeping up with all this new technology and innovation. What else is coming up?
The growing number of people with chronic diseases is another big one. Things like diabetes, heart disease, obesity. They're putting a strain on healthcare systems everywhere. Public health policy officers have to come up with ways to prevent these diseases, manage them better, and encourage healthier lifestyles.
It sounds like this role is getting more and more complex and demanding.
It is, but it's also incredibly rewarding. You're not just sitting at a desk. You're using your skills to make a real difference in people's lives.
That's what's so inspiring about this field. The chance to make positive change on a big scale.
Exactly. And with RoleCatcher's resources and tools, you're in a great position to navigate this challenging but rewarding career.
So as we wrap up this deep dive, what's the main takeaway for our listeners? What should they be thinking about as they get ready for this interview and start this career journey?
I think it comes down to this public health policy is constantly changing. It needs a mix of scientific knowledge, analytical skills, and a passion for improving community health.
It's about understanding how healthcare systems work, navigating the politics of it all, and using data to make smart decisions.
And most importantly, remembering that every policy decision affects real people. Your work as a public health policy officer can make a huge difference in people's lives.
That's a powerful thought as you prepare for this interview. Let your passion and dedication show them what you know. Highlight your skills and share your vision for a healthier future.
And don't forget you're not alone. RoleCatcher has tons of resources, including those AI tools to help you every step of the way.
So go out there and make a difference. The world needs passionate people like you to shape the future of public health.